Guys, welcome to my review over the knee. We're going to go through this list of questions that is on this side of the screen here. There are a playlist here if you'd like to go back and see any of those presentations. There's notes there. But let's get to what we're here for today. The knee review, study guide for the exam, which you'll be taking tomorrow or maybe right after this. First question, what is a lateral collateral ligament sprain and what would cause an LCL sprain? So an LCL or lateral collateral sprain, we're going to look those up in our notes here. So we'll go down to, we'll find the ligaments. So lateral collateral, lateral LCLs on the lateral side, the outside right here. What would cause an LCL sprain or stretching of this side of the knee? So my answer is going to be an impact on the inside of the knee is going to stretch the LCL or the outside ligament of the knee here. So what would cause a sprain would be a medial blow to answer this question here. And a ligament sprain, just like any other ligament sprain, it can be grade 1, grade 2, or grade 3. And that sprain is just a stretching or tearing of that ligament. Question number 2. An anterior drawer test for what injury? And what does a posterior drawer test for? All right, so we have the ACL testing is anterior drawer test and the Lockman test are 2 tests. And the second part of that question, a posterior drawer test for what injury? And that is going to be a PCL tear, a posterior cruciate ligament. Remember the ACL and the PCL, they run across, they kind of cross each other in the center, the very center of your knee joint where the intercondylar notch is at. They run through there. So the question, anterior drawer test for an ACL injury, posterior drawer test for a PCL injury. Question number 3, what muscles cause flexion and extension of the knee? So flexion of the knee, here's my knee, flexion of the knee looks like this. I'm using muscles always pull, they never push, so I'm using the back side of my leg. Those are hamstrings. And extension is here, and I'm using the top or the front of my upper thigh. Those are my quadricep muscles. Let's find those in our notes. And quadriceps and hamstrings on slide 8. Next question, question number 4. What is patellar tendonitis and what are the symptoms of patellar tendonitis? The next question is patellar tendonitis could be confused with what injury? So I'm going to go down in our notes where we talked about, I know patellar tendonitis. Patellar tendonitis is also known as jumper's knee. That may be something that comes up on the test. And the symptoms of patellar tendonitis would be pain on the front of the knee right here, where the patellar tendon inserts in the tibia, between the tibia and the patella. Patellar tendonitis could also be confused with our next slide, which is fat pad syndrome. The difference with fat pad syndrome, this is going to be somebody's going to have fat pad syndrome that is on their knees, constantly working like a plumber or maybe somebody in the airlines is crawling low under something. That would be a fat pad syndrome. But the symptoms are going to be very similar. As you can see, there's inflammation here. Next question, number 5. The patella is this type of bone. So here we actually have the patella. And it's talking about comminuted fractures. But what the patella is a sesamoid bone. There it is. Patella is a large sesamoid bone. You can find that on slide number 4. Number 6, list symptoms of an ACL tear and tests that would be done. So symptoms of an ACL tear, we'll scroll through and find those. The tests that would be done, we talked about anterior drawer test would be done. We talked about Lockman's test just a minute ago. Our 2 big tests. There's also a pivot shift test that could be done for an ACL tear. We're going to look up symptoms here in just a minute. The ACL prevents the tibia from moving anteriorly. The ACL prevents the tibia. Here's my tibia. Here's my femur. It prevents my tibia from moving anteriorly. That's that anterior drawer. You're pulling on the knee and you're pulling towards you. Symptoms of an ACL tear. Feeling a pop at the time of injury. This is very common. It can be a loud pop. Other people, your teammates, can hear this pop oftentimes. Immediate swelling after the injury in that joint. Deep pain in the knee. Instability, that feeling of giving out. Like I said, I felt like I had a baby giraffe leg when I tore my ACL. A restricted range of motion. So they only may be able to get to, instead of this is 0, your leg is completely straight, they may only get to -10, and then, I'm sorry, from 10 degrees to 100 degrees might be their range of motion. So decreased range of motion. The knee will feel warm to the touch. That's due to the bleeding, the swelling, the effusion in the joint. And the athlete may often use this symbol of this is what it felt like. And in my case, I looked down and I saw this happen to my knee. So that is the ACL. That is question number 6 answered. Well, what is the first thing a physician will do if you go to the hospital? First thing they're going to do the x-rays, which I think is on this test. They'll do those slide tests. They'll do the pivot shift test. So they'll do hands-on stuff. They'll ask you what happened. They'll ask you to explain the whole situation, how it felt, what your teammates saw, and then they will get you into x-rays to make sure that no bones are broken. Once they have the x-rays and know that no bones are broken, then they will probably send you for an MRI in the next few days. Then you'll get that MRI results, and they'll determine what action needs to be taken from there. Number 7, what is the function of the meniscus in the knee, and what are symptoms of a meniscus tear? And the next question, what is a meniscectomy? So there's tons, we had lots of information on meniscus. The function of the meniscus, they are shock absorbers that prevents our femur from crushing into our tibia every time we take a step and grinding that articular cartilage away. So that is the main function of the meniscus. Then the next question on that, list symptoms. What is the function of meniscus in the knee, and what symptoms of a tear? Some meniscus tear symptoms are going to be back up here. There's going to be swelling. There's going to be pain in the joint, popping, locking. The knee may give way, so they may be walking and their knee just gives out and they kind of jolt a little bit. They may even fall. Testing would be the Thessaly test or the McMurray test. And then the next question is, what is a meniscectomy? A meniscectomy is where, it's on the next slide here, they go in, if there's a tear there, they just trim out part of the meniscus. Ectomy is removal, so it's meniscus removal. You can have partial removal, you can have most all of your meniscus removed, but your meniscus is very important to the longevity of your knee. And so your doctors are going to try to repair that at all cost. What is crepitus? Crepitus. All right. Crepitus is the grinding or the popping in a joint. I have a video here. I'm not sure if you'll be able to hear it or not. If you could hear that, that is what crepitus sounds like. It feels like just a grinding, or I would explain it as a ratcheting feeling that is not comfortable at all. What is an antalgic gait? An antalgic gait, it says on this slide, but an antalgic gait is where somebody is walking abnormally because of pain. So if it's right knee pain or that right knee is stiff, they may keep that knee stiff while they are walking. Here is another short video of what an antalgic gait would look like. See how this knee is not bending? Oops, that didn't help. The right knee is not bending. That is an antalgic gait due to an injury. What is also known as jumper's knee? Oh, we actually already had a question about this, but patellar tendonitis is also known as jumper's knee. You do not have to do a lot of jumping to get jumper's knee or patellar tendonitis. There are other ways that that your patellar tendon may become inflamed. Other names for effusion in a joint. Effusion is just that swelling that happens in a joint. It's often warm to the touch after an injury, but effusion is swelling in a joint. Number 15, the patella rides in the blank of the femur. The patella rides in the blank of the femur. If we go back up to our anatomy, which was at the beginning of our notes, and this right here is called the trochlear groove. I'm not sure which slide that's on, but we can see the trochlear groove right here. So the patella rides in the trochlear groove of the femur. Number 16, what are some theories as to why females are more likely to tear their ACLs than males? Well, there are a lot of theories or reasons that they think females may be tearing their ACLs at a greater rate than males. Injuries in female athletes Females are 8 times more likely to tear their ACLs than males. Some reasons that could be, it could be hormone levels in females and the changing hormones. It could be that females have a wider Q angle, which remember we talked about the Q angle, the wider hips. A decreased intercondylar notch, and remember this is the intercondylar notch where the ACL and the PCL ride through there. The strength of the hamstrings, or it could be the biomechanics of how females are landing, how high they're playing with more straight knees, upright as opposed to bent knees. And so that's something in the training, and how we can try to prevent some of these injuries is training our female athletes to land with those bent knees and land correctly. Next question, 16, was that one? 17, who is at risk for ACL tears? Well, you guys know this. Who's at risk for ACL tears? Anyone that plays a sport where you are pivoting, you are cutting, you are decelerating, you're accelerating. All those things are what lead into ACL tears. So really everybody's at risk, male or female. The risk is just greater for females. Next question is, who is at risk? The next question is, what is your return to play time life for an athlete who has torn their ACL? And I saw that slide just a moment ago. The return to play for an ACL injury is 9 to 12 months. It's right here. Pretty small, so you can't really see it. But 9 to 12 months is a return to play for an athlete with a torn ACL after a surgery. And that 9 to 12 months starts when the surgery happens, not when the injury happens. Do I have one more question here? No. What is an autograft and what is an allograft? Remember we talked about autografts come from your body. So if somebody has a bone-to-bone patellar tendon autograft for a new ACL, they are going to take the center portion, see my knee here, the center portion of the patellar tendon, the center 1/3 will be taken out with a piece of the tibia and a piece of the patella, and it's going to be wound through and make a new ACL. It's an autograft. It's taken from your body. An allograft is taken from a cadaver, or is taken from a deceased body that doesn't need it anymore. So allograft is from somebody else, autograft is from you. Number 19, what is the most common mechanism of injury for an ACL tear? I bet we're pretty close to this here with these ACL notes, but we've gone over it many times. It is plant and turn. Don't see it right off, but plant and turn is the most common mechanism of injury. An ACL can also be torn if somebody a lineman falls on a player and bends the knee. An ACL can be torn that way. So there are other ways, but I believe the statistics are like 70–80% are non-impact, non-contact ACL tears. Number 20, what is a knee arthroplasty? And I believe we did this at the very end of our notes. An arthroplasty is the same thing as a knee replacement. So if somebody gets a total knee replacement, they are having a total knee arthroplasty. Last question, what is O'Donoghue's terrible triad? And I'll scroll back up to the top because that was the first thing when we started injuries. That's the first thing we talked about was O'Donoghue's terrible triad. And that is what I shared a lot of my experience with the O'Donoghue's terrible triad, the torn MCL, the torn meniscus, and the torn ACL. All right, so that is my review of the knee notes. And I'm sorry these were kind of out of order. I actually just used the order that I had from the test and went through and made sure that all the questions that will be on the test for this week is on this little study guide here, and I've walked you through them. You don't have to type them out. You don't have to turn it in anywhere. It's really for your own benefit that you have the study guide, and we're going to go through this. We will post this online. Good luck with your test, and make sure those are done by Friday, May 1st at midnight. Thanks, guys.